Let's talk about Haynes King, Texas A&M quarterback. You know, I've only been to College Station once, or maybe twice. I went there in college to work on a research project that actually sent me to Africa, my home country, Uganda, where I was born. Anyway, I was shocked at how big colleges are in Texas. I mean, I went to Berkeley, which I thought was a big, big school. I got to Texas and it just blew my mind. College Station, huge, huge campus. Anyway, back to football.
And their stadium holds like 110,000 people.
That's crazy. So Haynes King, first reports is that he had a crack in his tibia, which didn't really tell us much. Reports are now, and then there were reports about him having an ankle fracture. And I said, well, this is a non-displaced fracture. Well, still could be an ankle fracture from all sorts of places. This is the bottom part of the leg. This is the tibia bone. This is the fibula bone. This is the part of the tibia called the medial malleolus. This is part of the fibula called the lateral malleolus. And those two together with the talus form the ankle joint, with all the ligaments that hold it together, right? So, as it turns out, it's now being said that he underwent surgery. Okay, so I'm going to infer quite a few things from this. Because they said it was a crack, I'm going to assume that it was a minimally displaced fracture. So it wasn't moved that much, right? Now, in most normal individuals who aren't worth potentially millions, or actually maybe worth millions already because of NIL, right? They can be sponsored now, these college athletes. And I think it's about time. People have been making too damn much money off of them. If they're going to sell their shirts, they should get some of that money. Right, so anyway, in most individuals, if they have a minimally displaced fracture in the ankle, we'll often treat it non-operatively. We put them in a cast or a walking boot. Sometimes let them walk on it right away because it'll heal in a good enough position for that person to do well with avoiding surgery. But if you are worth potentially millions or an elite athlete, quarterback, a short displacement, a very minimal displacement, or a very small change in the anatomy in the ankle can really affect it, the biomechanics of the ankle. Shortening of the fibula, the lateral malleolus, by even a millimeter can make a big difference. Any rotation, okay, can make a big difference. But we're talking about the lateral malleolus, okay? That also can have effects. So, what they most likely did for him is, I'm assuming he had a non-displaced fracture, a minimally displaced fracture. What they most likely did for him was do a surgery where they fired a couple of screws across the fracture site and tightened them down to lag that fracture together, make it more stable, allow it to heal. Bone heals better with compression, and that's what those screws will do. I think that's what's probably happened to him. He had surgery, so I imagine that he put in a couple medial malleolus screws, held everything together, and he is going to be in a cast for about 6 weeks, probably switched over to a walking boot after that, and then back to playing. Now, remember, I don't let my patients get back to doing what they normally would do until 3 months after surgery, but I keep bringing up Terrell Owens. Remember, he had a nasty ankle fracture, the syndesmosis injury, and then played in the Super Bowl 6 weeks later. So, Haynes probably will be back sooner than 3 months.